All right. Welcome back, everybody. My name is Dr. Khan Kao, and I'm glad you guys can join me today with two endocrinologists. This is our first time that we'll have a joint sessions. Today, we're joined by Dr. Lyubuv Olenina and Dr. David Nee. Welcome.
Thank you.
All right. Both of them have 7+ years of experience as endocrinologists, so they'll be giving us great tips and advice regarding what one should look for if they're interested in pursuing to be an endocrinologist. All right. So we'll start off with Dr. Olenina and then Dr. Nee. Just tell us a little bit about your background.
Well, I graduated medical school in Russia, and I'm a foreign graduate, so I had to get ECFMG certified, pass my USMLE exams, and then enter internal medicine residency and endocrinology fellowship, and subsequently took a job in Shreveport, Louisiana, with the hospital system called Willis-Knighton, and I've been here for 7 years.
Okay. All right. All right, David.
I basically went to med school up at Temple. I did my residency at GW down in DC and my fellowship also at GW and the Veterans Hospital. My first job was actually academic up at Temple in Philly, but then I decided to kind of change my pace, and I basically, I think 6 or 7 years ago, found a different job at a practice closer to home up in the suburbs. I'm at a practice called Maryland Endocrine. We're basically a group that has 10 partners, essentially. We used to do inpatient, but now it's really just an outpatient private practice clinic.
Okay. All right. Awesome. Thank you for that. And could you, we'll start with David. Could you describe us a brief description of what the job entails?
These days it's just outpatient clinic. So effectively the work hours basically kind of go from 8 to 5. Full day is basically 7 hours face to face, and then you just basically have time to basically kind of review labs, return phone calls, refill prescriptions, and kind of work up cases in between interpreting data. We basically see diabetes, thyroid, that's like a major part of it, but we also have issues with osteoporosis, hormone replacement, electrolyte disorders, and just incidental findings of thyroid nodularities, thyroid cancer, adrenal nodules, and pituitary issues, everything you basically expect from endocrinology.
Okay. All right. So think back to your med school years, since the audience is mostly med students. And I know regarding endocrinology as a fellowship, when did you decide that you wanted to be an endocrinologist? We'll start with Dr. Olenina.
Well, I knew that I was going to be a doctor as long as I remember myself. Both of my parents are physicians, so I kind of thought, I'll go into internal medicine. But in medical school, I sort of struggled with hormone physiology, and but once you grasp it, you cannot unsee it, and you love it. So probably during the physiology course, I figured probably endocrinology. So that's
all right. Dr. David?
So with myself, I came into internal medicine just thinking, I want to kind of do office, just basically sort of like an office-based practice. And I think as time kind of went on, I had a biochemistry background back in undergrad. I felt that endocrine was probably like the best fit for me. It basically sort of synergized with my pre-medical school background with the biochemistry, but also it was just kind of fulfilling to not only sort of kind of deal with the diabetes aspect, but there were also surprisingly just some interesting cases on the wards. I dealt with a mysterious case of hyponatremia, which I thought was antibiotic mediated just because it kind of resolved after we stopped antibiotics. There were definitely times when I had to deal with tricky hypoglycemia cases. So just essentially having like the bread and butter, the routine of like diabetes and thyroid, but also having interesting cases to kind of change up the pace of things really kind of got me interested in endocrinology. It also helped that, I had a pretty good rapport with the attendings on endocrine. So having those connections, sometimes it's not only what you know, but who you know, that basically helps out greatly. But ultimately, it just gave me like the specialty itself doesn't have that many procedures. I like doing procedures, but the ones that I do get, I think I can do very, very exceptionally well. But also it just didn't have as much of the stress that I thought was associated with some of the other cases. People rarely code with endocrinology.
That's probably true. And what other specialties or internal medicine subspecialties were you considering, and why did you not choose that and end up choosing endocrinologist? We'll start with Dr. Nee first.
I think for me, I was looking in terms of like, I was interested sort of like in infectious diseases as well as rheumatology at the same time. With rheumatology, I thought it was a bit more esoteric and more memorization. Essentially with endocrinology, as Dr. Olenina had kind of pointed out, you have pathways, and there was like a very strong biochemistry logic to it as well. In terms of, of infectious diseases, with all due respect to the infectious diseases doctors who are very brilliant, I just felt that having a 3-page census every day as a student was a little bit taxing, and just the fact that kind of rounds went to like 9 p.m. I love infectious diseases, and it's like being able to throw out antibiotics and kind of treat those sorts of situations are great, but I think the census on endocrine was a little lower than on infectious diseases.
All right. And Dr. Olenina?
I have considered GI, like my mom.
Mm-hmm.
I really liked infectious diseases as well because I like microbiology and pharmacology. Neurology was great. When I was in medical school, I thought how wonderful, just with the patient complaints and a good physical exam, you can pretty much pinpoint where the problem is in the nervous system. But ultimately, with the endocrine rotation, it was coming back to endocrine. So endocrine was.
All right. Thank you for that. And Dr. Olenina, can you just describe us the typical training path for to become an endocrinologist? And then either of you can talk about the subspecialties on top of it, further fellowship if there are some.
Right. So, yeah, after medical school, you enter internal medicine residency, which is 3 years. And after you complete that, you go into endocrine fellowship, which is 2 to 3 years. I completed a 2-year endocrine fellowship. There are other subspecialties that you can choose if you want to do lipidology. If you're interested in thyroid cancer, there is fellowship in that. If you're interested in osteoporosis, there is mineral bone disease fellowship, lifestyle medicine. So if you want more training after endocrine fellowship, you can keep going. So.
Okay. All right. Thank you. Do you have anything else to add, Dr. Nee, on that one?
That's pretty much the course.
Okay. All right. Thank you. Are there any specific characteristics, and we'll start with Dr. Nee, a personal quality that one should have to be successful as an endocrinologist?
I think that with endocrinology, what really helps me out is just attention to detail, essentially. I mean, as a subspecialist, it's like, well, actually, just as a resident, I just remembered, like, when I was on the subspecialty rotations, they often stated that, anything that the primary team doesn't pick up, the subspecialist should be able to pick up as well. So I like to kind of stay up to date and current. It's nice with like the conferences when you go sort of on a yearly basis. It's sort of like the same niche of like the same characters, the same professors, basically sort of giving you updates. But ultimately, it's a lot of detective work. Essentially, not only do you kind of like look through like medications and kind of remember just like potential side effects and effects on electrolytes. But I just like kind of piecing together sort of like it's kind of like House MD, except that it's like supercharged for basically just your outpatient work. But ultimately, I'd say that it's really just attention to detail, and having some interpersonal skills helps a lot too. Sometimes there are things that you discover with patients that that they don't teach you like in a textbook. Like essentially, you may be finding that the team or the patient needs like higher and higher doses of insulin, but at the end of the day, it turns out that it was something silly like them like not taking off the cap off the needle, essentially taking the time to know your patients and just asking like the simplest question can sometimes like totally lead to the answer with these medical mistakes.
Awesome. Thank you. Anything you like to add, Dr. Olenina?
I agree with David, and history taking skills and physical exam skills are important. Sometimes at first you think you're just dealing with garden variety diabetes, but if you have a degree of clinical suspicion and go the right pathway, it can be something interesting. For example, Cushing's. So you really have to be attentive and try to, talk to your patient and pay attention.
All right. Thank you for that. And then is there anything or just one thing that you think could you could change regarding your subspecialty of endocrinology? We'll start with Dr. Olenina.
I couldn't answer that question. I still think after 7 years in the field, endocrinology is the best.
Fair enough. Well, what about Dr. D?
I could stir up a little controversy and just basically state that I think the medicine part is very straightforward, but ultimately the real challenge sometimes is getting the medications covered. I think that it is kind of unfortunate these days that effectively sometimes the best medication, it basically is cost prohibitive. And then, as an endocrinologist, you have to get creative with some of your medication regimens. But ultimately, on the private practice side, where you basically have a lot of staff helping you out in terms of the prior authorizations and getting sort of like the letters of denial from like the insurance companies, that ultimately is probably the toughest part. And it's not so much like the medicine. The medicine is enjoyable, but the bureaucracy that you have to deal with sometimes is a little less desirable.
Yeah, that from what I've heard from other subspecialties or specialties, the, the the access to care, the cost prohibited, the insurance issues can be frustrating, and that I guess leads into my next question, which is we'll start with David, Dr. Nee, regarding what do you think is the frustrating aspect of being an endocrinologist, and then after that, when he's finished, Dr. Olenina, if you have anything else to add.
Well, aside from just the medication costs that sometimes are challenging, I think that sometimes you feel like the system is set up such that that essentially, it's like if someone sees like, oh, they have diabetes, they just basically kind of just delegate all of that to the subspecialist, or essentially you kind of end up with a system where essentially everything is like problems based and everything is basically kind of outsourced. Sometimes it doesn't feel like there's enough effort put, but I understand from like a generalist side, sometimes what can happen is everyone's time is limited, and if someone comes in with 13 problems, you take care of life-threatening ones and you have to outsource. So I feel that that essentially sometimes that just basically leads to more work, just as you refer out to other subspecialties.
And Dr. Olenina, anything you'd like to add?
The most frustrating aspect is definitely managed care, because you know what is the best for the patient, but the insurance company starts arguing with you, and they have the pick of the medication within class or which technology they would allow. And I agree with Dr. Nee.
All right. Yes. Thank you for that. I'll get to my next question, which is the better version. What do you and Dr. Olenina, we'll go with you first. What is the most exciting aspect of being an endocrinologist?
To me, it's just daily work. I like coming to work. I tell everybody I go to work with a smile and I leave work with a smile when I get to go home. So uh, I like the continuity of care because our people with diabetes, we see them every 3 to 4 months, and it's rewarding to see the numbers improve. So when you manage diabetes, you can see the numbers improve, and that gives you satisfaction in your job. And of course, I like helping people feel better. For example, with thyroid disease, if you replace their thyroid or if they need their thyroid blocked, 3 4 weeks they start feeling better and they share it with you, and you're happy with them and you're satisfied with your job. And then some other conditions in endocrinology, we don't necessarily have numbers to show for it, or they don't feel better. For example, when we manage lipids, and we know that statins and other agents are proven to decrease cardiovascular risk for this patient. And I know that just by giving the statin to the appropriate patient, we decrease the risk for a heart attack or a stroke. And it's just rewarding to help people. And I find that exciting about endocrinology.
And Dr. Nee.
I agree. I think that essentially seeing people improve through your efforts definitely is very fulfilling. Even better is just when you sometimes have like the parathyroid patient who basically is surgically cured and doesn't really have to see you ever again. And I mean, it's not like hard and fast, but some people actually do feel significantly better, less malaise when they do have their parathyroids removed. Ultimately, I think what I also enjoy or get fulfilled from basically from the profession is basically being able to sort of lend my expertise and actually teach people and empower them against the conditions that they're basically fraught with. And when you basically see their faces light up and basically the knowledge kind of just like clicks and they learn to take better care of themselves, that ultimately, always leads to better outcomes and knowing that you've improved other people's lives just through your training and your knowledge, that basically is a very high point of the profession.
Okay, awesome. Thank you for that. And you both work from what I think is a pretty cush schedule, Monday to Friday, 8 to 5. Can you just reflect on how the subspecialty has influenced your work-life balance? And uh, is this a typical of what most endocrinologists work schedule like, or if there's any other schedule that most endocrinologists work at as well? And we'll start with Dr. Nee.
In terms of work-life balance, I think it's really kind of relative. I mean, face to face, like I see patients like 7 hours a day, like 5 days a week, like 35 hours. But ultimately, I think with like every other subspecialty, there's a lot of like behind the scenes work that doesn't necessarily get shown. I think in order for me to run on time, I do have to have some prep work done beforehand, and it does come out of like the time after hours, before hours, and sometimes on weekends. But honestly, I mean, the work needs to be done. Like, the labs aren't going to review themselves, and essentially, you want to maximize the time you have with the patients, which is literally like 20 minutes. So, I mean, for the best interest of the patients, I don't mind, reviewing the history and generating a plan beforehand and revising it obviously after the encounter. So, I mean, I really do more than 35 hours.
And Dr. Olenina, anything you'd like to add?
A part of wonderful clinical aspects of endocrinology, I appreciate endocrinology for giving me the work-life balance, because it's important to me to go home to my family after the workday and be able to spend the weekends and holidays with them. And I really appreciate that. We do take call for our patients, and we do get curbsided by phone here and there over the weekend and things like that. But it's minimal, and I enjoy those hours. If you choose endocrinology and you would like to do hospital call, there are very many positions out there available who want you to do both. But ultimately, when you choose the job, when you go for interviews and see what the practice has to offer and what the demands are, you can make the choice based on, if you want just ambulatory or if you want to do both hospital and outpatient.
Mm, okay, thank you for that. And so how do you see endocrinology change in 10 to 20 years? And we'll start with Dr. Olenina.
Well, there is a great demand for endocrinologists right now, just judging by the emails and mail outs that I get, come to our place, come work for us. I think the demand is there, and it's only going to grow. There is, in my lifetime as a physician since 2002, endocrinology has changed significantly. Insulin pumps are smarter and easier to use. The continuous glucose monitoring is more precise and, again, user-friendly. There are different classes of drugs in the past 20 years that appeared on the market. The GLP-1 receptor agonists, SGL2 agents, and we're getting new indications for these medications. And there are a lot of new diabetic drugs and lipid drugs in the works. So I think that endocrinology is going to grow and expand and get more detailed. So I think it has a bright future.
All right, thank you. And Dr. Nee, anything you'd like to add?
So I definitely agree with the technology aspect. Essentially, CGM and pumps are becoming more intertwined. So you basically have pumps that can sort of manage themselves, like Medtronic's auto mode algorithm or Tandem's control IQ algorithm. I feel that with the pandemic and the rise of telemedicine and just like the increase in reliance of like technology, ultimately, it's like it's a lot easier to get more comprehensive data. And I think people are kind of realizing just what a big deal diabetes is. I think that there's been like a good shift in the paradigm, essentially tying insulin resistance to basically obesity. So many of the classes of medications that were mentioned essentially also have like secondary effects of basically sort of improving one's weight profile. Essentially, the GLP-1s are being sort of like marketed now because they have like a significant weight loss effect, and the SGLT2s can also mildly help in terms of weight loss as well. Essentially, I know AstraZeneca was kind of pushing for like for basically cardiometabolic derangements, and I think they have a cardiometabolic fellowship as well. But I think more and more people are just kind of realizing just how much endocrine kind of plays a role into both like cardiac function as well as like kidney function as well. So I think that there is a significant demand and a significant expertise, a significant role that we have as endocrinologists in terms of just the cardiometabolic dysfunction that people invariably get themselves in as they kind of grow older.
Okay, awesome. Thank you for that. And do you work with mid-levels such as NPs and PAs, and do you see their responsibilities changing over the years? And we'll start with Dr. Nee, and then if you have anything else to add, Dr. Olenina.
At our practice, we currently do not have mid-level providers. It's basically just 10 positions total. But I know like during residency and fellowship, essentially at an academic center, we definitely had more physician assistants and nurse practitioners. And I think that, certainly they can play a role and can probably be trained to basically sort of make decisions that can be supervised by attendings. But at this point, just with my private practice, I don't have enough experience to really sort of comment.
All right, thank you. And anything you'd like to add, Dr. Olenina?
We're physician-only practice. We do not have any mid-levels. So.
Okay, all right, thank you for that. And how do you see the job market in 5 to 10 years? We'll start with Dr. Olenina.
I think endocrine job market is expanding. It will be there for you, medical student who is watching this video, once you graduate and complete the training. Yeah, okay. The job market is vast and busy right now.
Okay.
I would definitely agree with that assessment. I would say that there are a lot of headhunters or recruiters out there that are, blasting emails. Oftentimes it's to probably areas that may not be as well served as sort of like, the urban, suburban areas. But I don't think that there's ever really going to be a shortage. If you basically look at like the wait time that I have, it could be anywhere from like 2 to 3 months. So certainly I think that there is definitely a market for somebody who's interested in it.
Awesome. Thank you. And if there's for students who are interested in learning more about endocrinology and see if it's a good fit, what additional helpful resources can they use? We'll start with Dr. Nee.
Well, there are probably like two or three major societies. There's like the Endocrine Society, as well as the American Association of Clinical Endocrinology, and the American Diabetes Association. So, I mean, essentially, as a medical student, if you're kind of interested, and you're kind of proactive, and you're doing like endocrine rotations, it might be worthwhile to essentially see if you can get some lead time in which you can probably, join one of these conferences that they have annually, to basically kind of get like the breadth and the scope of what's out there in the field. You can certainly interface with a lot of like the celebrity, or I wouldn't say celebrity, but essentially like the professors of endocrinology, the superstars, so to speak. Again, like, it's like the in the academic realm, you know like all the major names, and they're very accessible.
Okay, thank you. And anything to add, Dr. Olenina?
Yeah, I was going to say the same. Endocrine Society, see, they both have trainee corner and interdisciplinary groups online that you can join and read up on. So,
Okay,
yeah.
awesome.
There are resources online.
All right, thank you. All right, so my last question, and if you guys have anything else to add on top of it that I could miss, or potentially what you think is useful for the students to know, please feel free to add anything you like. That this is your time to put any additional comments and whatnot. So what is or what are your top tips to students who are interested in endocrinology? And we'll start with Dr. Olenina.
Well, obviously, if you're watching this video, the thought of becoming an endocrinologist has crossed your mind. So that's great. My top advice is to rotate with an endocrinologist. See their day from the beginning to end. See how they review data, how they talk to the patient, what kind of physical exam is involved, how they interpret the data they collected, and the recommendations. Look at the pump and CGM downloads, because it's fascinating how you can just have a big snapshot of what's going on with the patient's blood sugars and how the patient's behaviors are affecting the blood sugar control. And if that endocrinologist rounds in the hospital, definitely go around and see the patient with them also, so that you can decide if this specialty is for you.
Dr. Nee.
Yeah, I definitely agree. You want to get like the full body experience, kind of like go through like at least a day, if not like a few weeks or maybe like a month, like on rotation with like endocrine. But certainly, interact well with your fellows. Oftentimes, they're sort of like the intermediary between yourself, the attending, but, you can certainly like be proactive and also kind of interact with like the attendings as well. I would say, it's like if you're really interested in terms of endocrine, you could even try to pick up a little research on the side, a little project on the side. But, it's about having a good rapport, because ultimately, even if you don't end up matching like at your home base, you'll basically have connections, and essentially like just with endocrinology, no practice, no endocrinologist is an island. It's like we all get stumped from time to time, and the nice thing about our specialty is that with the superstar, so to speak, at the conferences, it's like their emails are very accessible. Like if you know like a few like top leads like in the field, and you just happen to have like a puzzling case, it's not unreasonable to essentially kind of reach out and basically kind of interact. But like socialization is a big part of endocrinology.
Okay, awesome. Well, that concludes my questioning. I appreciate Dr. Olenina and Dr. Nee for your time and knowledge of 7+ years of practice, and hopefully it's useful to students. I've learned quite a bit regarding the subspecialties, and so I can imagine the students find some of these information useful as well. So I appreciate you guys doing this and spending your time to give back to the students' medical education. So thank you.
Thanks.
Thanks for having us and letting us share our experience.
All right.